For those of you not familiar with Dr. Koch, he's married to Sandra. She's also a doctor. They have four, grown children. They live in Winterburn. Anybody Winterburn? Shout out. Okay. And Mike, he works in geriatrics, cancer care, and palliative care. And so he kind of knows what we're talking about today. So thank you for joining us, Mike.
Sure.
Great. So Mike, from what you've observed over the years and in your experience, could you speak to us about kind of suffering as we age? With aging, you know, we have the decline and we suffer. Could you share some thoughts with that?
Yeah, happy to. Good morning. So when we're talking about suffering, we're talking about loss and decline. And everyone at some stage of their life is going to experience some degree of loss and decline. When you're younger, kind of what you were describing, these losses and these times tend to be shorter lived, days to weeks, and things like sports injuries, minor viral illnesses, and you're able to bounce back pretty quickly to your previous baseline. But as we age, especially in our 70s, 80s, and 90s, this gets more and more difficult, and you start experiencing the cumulative effect of these recurring illnesses. And we start calling that a stepwise decline. And then in the end, as you reach this older age, it starts contributing to your frailty and your overall disability. So I want to mention, though, that I see a very skewed population in hospital, right? So I see a lot of folks who are sick with multiple illnesses. They are not representative of the community. And I just want to stress there are very many seniors living out there who are independent or relatively independent living in retirement homes. However, all of us will experience some degree of loss and decline in our lives, and it's usually either gradual or acute toward the end. So I guess I want to get a flavor for what that loss and decline might look like. And in the process, I thought we'd have a little quiz. We're going to start off lighthearted, and then it becomes a bit darker. So the lighthearted part's because it's a serious topic we're talking about here, but the darker part of things, this is based on real life, real world, but hypothetical patients so that we don't identify anybody personally. So on the lighthearted side, and again, I have these things happen to me, so I think they're part of normal aging, okay? So Dan, you kind of alluded to this in your sermon. Are you able to get up from squatting on the floor without letting out a little grunt? I know I cannot. I cannot. And it's subconscious, and your wife will hear it. So kids, how many times have you heard me say, "Where are my glasses?" Way too many times, right? And this week, a nurse said, "They're right on your face, doc." So that can happen. How about, Dan, you were having some back pain, and you noticed that your underwear and socks were on the floor at home. You looked at them, you analyzed them, you thought to yourself, "I really should pick those up. But is it worth the pain I'm going to have, and I'm not sure I'm going to be able to get back up again?" So you left them there?
I actually used my leg and my foot.
Way to go! Excellent. Way to go. Way to go. Impressive. Now, the toilet seat, I'm not sure about. You'll have to work that out with Lisa. And then one last idea. You're walking into a room. You had something you were planning on doing, but by the time they got there, you completely forgot why you were there, right? How many times have we had that? Mm-hmm. Okay. So getting a little bit more serious now. You are out driving somewhere to a place that should be familiar to you. You become completely disoriented, lost, you pull over, and in your embarrassment, you're utterly embarrassed, you call your kids for help. And you're actually so flustered that you don't remember how to use your cell phone. Or your world has become really small, and part of the reason you don't socialize anymore is the last time you went out, you were incontinent of urine, and you were just devastated. You're never going to do that again. Or your hearing has become poor, such that you can't really follow conversations anymore, and why bother? How about you've got multiple medical issues, you've got Parkinson's disease, heart disease, you've been told you'll never walk again, and you now need assistance even to wipe yourself after you use the washroom. You need long-term care, you need a nursing home, and you promised yourself you would never, ever go to a place like that. You'd rather die. And then lastly, you've just been diagnosed with dementia. It's early stage, it's mild in severity, but you are so utterly terrified of the future, of losing control, that you actually talk to your doctor about euthanasia, and you are approved. So this is hard stuff. Now, we started off with what are more or less minor inconveniences, but progress to things that are significant losses and declines. So we're talking about suffering, different variants of suffering. Now, I don't claim to be an expert in the whole theology of suffering, but I certainly have seen a fair bit of it over the course of my career, and I've found a certain framework that has helped my head and heart to get around this issue. Otherwise, I couldn't do my job. And it's based on an Austrian neurologist and psychiatrist named Viktor Frankl. He was a Holocaust survivor, and he practiced both before and after World War II. And he treated mainly depressed and suicidal patients. And because he was a Holocaust survivor, he had been in one of the camps, and he analyzed what was it about the camp, what was it about the people in the camp, that some people were able to continue to have that will to survive, and some died, some of them giving up the will to live. And what he wondered about was these things that normally give us meaning. He analyzed them, and he thought and called them a collection of meanings that lend sense and purpose to your lives. So what kind of things would these be? Family, peer approval, material wealth, health, love, all these things that would normally give you purpose and meaning were absent in these camps. So what was it about these people that allowed them to still survive? And what he found was that these survivors had purpose or meaning or hope. And so we came up with a formula, and it was D equals S minus M. Despair is suffering without meaning. And we'll get back to that.
Great. Suffering without meaning.
Suffering without meaning.
Okay. You talked about a couple of the fears maybe that aging brings, not being able to control yourself. How does faith then play into that?
So when I, first of all, just touch on fear. When I speak to patients, I'll often ask, what are you afraid of? Or are you afraid? And I'll get some interesting answers, especially from folks who are psychotic and delusional. But the average sort of regular answers are fear of intractable pain, things you touched on, fear of falling, fear of taking all these pills that this doctor keeps prescribing to me, fear of going to long-term care. But there are two areas where patients who are particularly interested in seeking death, recurring themes. One of those is the fear of losing control, and the other is the fear of being a burden to your spouse, your partner, or your kids. And that just is a recurring finding for me. So what is the Christian response to that kind of fear, that kind of suffering? And if we return to that formula, so D equals S minus M, despair is suffering without meaning, that's where faith comes in. So in light of our faith, is there a purpose in what you are experiencing? And for us as Christians, if our meaning is rooted in Christ, and if our meaning is rooted in Him, then we can look to Him and in His suffering find hope. So what better time than during Lent, when we can gaze on the suffering Christ, meditate on that, identify with that, because He identifies with you, but then look toward Easter and celebrating the risen Christ and His victory and the redemption of all your suffering. So one caveat and one sort of footnote is when we're talking about faith, I do think it's important that sometimes we think having faith means never being discouraged. And I certainly have seen discouraged Christian patients, but generally they don't lose hope. And so I would suggest that we try to avoid feeling guilty about these feelings, because that's part of normal life and it just compounds the problem. But my prayer for you in the middle of your struggle is that you might feel discouraged, but that you would never despair or give up hope altogether. But to get there, we really need to acknowledge that what you're going through is really hard. And anybody in your circumstance would find it hard. When I speak to patients and families who are dealing with dementia and behaviors, it's hard. And that's just one example. But if we acknowledge the difficulties and we grieve our losses, I really do feel that's the beginning of healing and when we can be lifted up.
Wow.
Yeah.
Okay, and then as well, Mike, with those you see, I'm sure there's isolation, loneliness, which many of us experience, but to a significant degree. And could you speak to that?
Sure. So imagine you are dealing with all the stuff we've just been talking about, and you're all alone. And on top of that, you probably have a little bit of cognitive impairment, physical impairment, trying to get yourself around the whole whatever's going on. So you're all alone. That would be completely terrifying. So that's where we as a society, as a community, and especially a Christian community, need to come in alongside these folks. We cannot distance ourselves from people who are experiencing this, even though they may remind us of what we could become or what our future could be. We cannot abandon them. They are vulnerable, and we need to be there. And so sometimes I dream about a society where, rather than agreeing when an elder says to you, "My life is not worth living," but instead speak biblical truth into that, and despite the fact that they may not be able to see it themselves, speak truth and love and hope. What if instead of offering death or euthanasia to desperate and hurting people, we could wrap care around them, wrap ourselves around them, and provide the assistance and the encouragement that they really do require and deserve. Now, I don't know what that entirely might look like, but can we dream and pray and be creative as God's community and figure what that could be, and then see what happens, right? Maybe we can't go back to the days on the family farm where Grandma had a stroke. Grandma's bed was brought down into the kitchen, the center of family life, next to the wood stove, nice and warm. She might not have been able to participate in all the family life. I know this is a Little House on the Prairie, but it still happens. And some of our older folks may remember this. I remember this from some of my relatives. But there in the center of family life, where all the action was, maybe not able to fully participate, but still part of the family, and they probably died in that bed. So maybe we can't reproduce that in modern society. Everybody's working, everybody's busy, everybody's stressed. But could we come up with some sort of alternative acceptable scenario? Maybe a scenario where we could address these people who have these concerns of being alone, of being a burden, and that real big one of losing control. Can we create a system where it's okay that you're going to lose control because somebody is going to be taking care of you, have your best interests in mind, and love you? And within that context of caring community, I just want to stress 3 words. These were coined by a doctor named David Kuhl. He wrote a book called What Dying People Want. So he was dealing mainly with end-of-life care, but really you could apply this to the last 5 to 10 years of your life as well, depending where you are in your life's and disease process. And And what he came up with was 3 words: truth, touch, and time. This is what dying people want, and this is what I think a lot of people want. So truth, spoken, but not at the expense of reassurance and hope. Touch, both physical and emotional. And time. Time to come to terms with their illness or illnesses. Time to come to terms with their losses, unresolved issues, and time to see if there are any unresolved hopes and dreams that you could still fulfill.
Okay, great. A question, 1 or 2 more. Aging well. Could you share with us some, tips or whatever?
Sure. So, the goal of geriatrics or geriatric care is to optimize what you have. So we're not generally able to cure chronic illnesses. These are there, but can we optimize them? Can we treat potentially reversible conditions, get you as good as we possibly can, and then find out what you need assistance with, and then look at a living arrangement that will accommodate that need for assistance. So that's geriatric medicine in a nutshell. But you can make a big difference for optimizing your health. And I would suggest that you start in your 20s, not wait until your 30s, 40s, or 50s. And the reason I say this is, for example, I have a lot of cancer patients who they're diagnosed with cancer, and then they'll come in and say, "Doc, I've really started eating better and I'm exercising now." And I'll say, "Great," but and then in my inside voice will say, "It's too bad you weren't able to start that years ago," because it could have made a difference. So this isn't a guilt trip. This is thinking about the future. So early in your life, start doing those things that could slow the progression of diseases or the onset of diseases. So things, you've heard all this: exercise, weight training, especially in the elderly, it's been shown to make a huge difference for frailty. Socialization is very important for cognition and stimulation. And during COVID, I saw my dementia patients go downhill rapidly because they weren't getting any stimulation. The Mediterranean diet, if you can manage it, and optimize what you've got. Your hearing impairment's a risk factor for dementia. Get enough sleep if you can, reduce stress, yeah, right. And the importance of structure and routine in everybody's life. What's good for your 3-year-old is good for you as you age. Minimize alcohol, fewer than 2 drinks a week, and try not to smoke, those sorts of things. And again, the important part of this is they may, especially in dementia, delay the onset of dementia and slow the progression of the disease. And not to be forgotten is your spiritual health, right? So attend to the physical, but also attend to the spiritual.
Oh, that's great. Anything else?
Yeah, if you haven't guessed by now, I love old people. And I just want to say to old people, seniors, the elderly, that you are amazing. And I take my hat off to your resilience. When I think of the things that you have seen and done, I think of my Oma. She was born in 1900, she died in 87. The things that she saw: 2 world wars, the Depression, forced immigration from the Netherlands to Canada. She didn't want to come. I think of, she started with a horse and buggy. I know we have them around here, but we've got cars and we've got space travel. From no phone to party line to cell phone. She didn't have one, but now we do, and we've got this computer in our hand, and now we've got AI. So the resilience that older folks show. But more importantly, one other thing is, you also remind us of what we take for granted in the modern age. So there was a parishioner at St. Jacob's Mennonite Church who, when asked what was one of the most life-changing things for you in your lifetime, guess what she said? "I got a washing machine." And she said she never stopped giving thanks for that washing machine.
There you go.
So little things to us. But I want to also say to older people that your spiritual legacy is what we need to witness, to hear. I've been talking a lot about what we can do as a community for you, but what you can do for us, I think, is just as important. We need to hear your story, and we need to hear your voice. So talk to an older person. Ask your grandma and grandpa about their life story, their faith walk. It's worth listening to. Yeah.
That's great. Thank you, Mike. So everybody got it? D equals S minus M, is that right?
Despair is suffering without meaning.
And the 3 T's that dying people need: truth, touch, time, and then the big one, of course, dying people need Jesus, right? And that's what we're all about. Thank you, Dr. Koch, for being with us. Could we share it?